Hello and welcome to another special edition of a patient education program brought to you by Intermountain Health. My name is Greg Moss. It's a pleasure to join you today and thank you for spending a little bit of your time as we discuss colorectal cancer. This is Colorectal Cancer Prevention Month. Today we're going to talk about prevention tips, learn a little bit more about this disease, how preventable it is, and some of the important screening tips you need to know about as well. Let me introduce you to our guest, Missy Wright. She is with the American Cancer Society. It's good to see you, and thanks for our partnership with the American Cancer Society as well. We do a lot with you all and we appreciate that.
Thank you.
Let's talk about colorectal cancer. How common is it right now?
Colorectal cancer is the third most common type of cancer diagnosed in men and women.
And it's equal parts men and women?
Yes.
That can have this? And it's surprising to me, we talked about how deadly this disease can be as well. Talk a little bit about that.
So it is the second leading cause of cancer-related death.
Wow.
Yes.
And it's so preventable.
Yes.
But we have to take responsibilities for ourselves in this arena, especially when it comes to screening. So talk a little bit about that.
Yes, so average risk individuals should be screened at starting at 45. So you can talk to your doctor. There are multiple screening options. So there's colonoscopy and then there's stool-based tests that folks can do from home.
There are differences between both of these tests.
Sure.
The colonoscopy is kind of the gold standard for sure. You can do the at-home testing kits as you just mentioned. I think colonoscopies can instill a little bit of fear and uncertainty in folks. Talk about that and why we shouldn't be worried about it.
Sure. It's definitely gotten better, as we talked about earlier, right? Like the prep of it. Folks have to take time off of work and arrange a ride, and it can be a little bit of a burden, right? So that prevents people from getting screened. But colonoscopy is better and can catch polyps at an earlier stage.
What we'd like to do is kind of catch this upstream, as we talk a lot about in the healthcare industry, and that's prevent it from ever happening to begin with.
Exactly.
Lifestyle does play a big influence in this. Talk a little bit about how we can change our lifestyle and what we need to pay attention to.
So cancer risk, your cancer risk goes up with certain lifestyle practices. So we want to decrease our risk as much as possible, and so that's through physical activity. It's diet, right? It's not smoking. So all of those things will help lower our risk in general for all cancers.
We hear a lot about the American Cancer Society and the many programs that you have. Talk about some of the resources that people can access.
So we have lots of resources, screening and prevention resources available, as well as if a person is diagnosed with cancer, they can contact the American Cancer Society. So we have a 24/7 availability through our cancer helpline at 1-800-227-2345, or folks can go to our website at cancer.org.
And again, 24/7, those are accessible to people.
Absolutely.
What would be your best advice for someone who is wondering about whether or not they've got some symptoms or whether they should find out some more from their primary care physician?
Well, contact their physician first of all, right, and talk to them. There's many factors, right? If they've had a family member with cancer or various things. So I think just starting with their physician and telling them what they're seeing or experiencing would be the first thing.
Don't ignore it.
No.
That's for sure.
Right.
Missy, thanks so much for joining us. Thanks again for all you do.
Yes.
You've got the website for American Cancer Society. Intermountainhealth.org is our website if you want some more details about colorectal cancer, but also how to find a primary care physician. We appreciate you connecting with those physicians as soon as possible. Always good to see you, Missy.
Great. Thank you so much.
Thank you so much.
Hi, I'm Gabrielle Cahill. I'm 34 years old. I am a new mom. I'm an instructor of dance at Colorado Mesa University, and I am a colon cancer survivor. I first realized that there was something happening in my body about halfway through my pregnancy. I started to have pains in my lower right quadrant.
So I first met Gabrielle during her pregnancy, actually, when she came in with iron deficiency anemia, which is pretty common in women who are pregnant. I met her again after pregnancy when she was diagnosed with her colon cancer.
The few weeks after I delivered my son, everything was okay. I didn't have any pains, I was feeling better. And then I would say about 4 weeks postpartum is when the pains started to come back in my lower right quadrant. And they found my mass in my cecum. It was presumably stage 3. I have a 5-week-old and I'm a new mom. This cannot be happening. How is this happening? I would say I was scared and ready to fight.
I mean, I can see myself in Gabby's shoes. I mean, she's close to my age, young new mom, and just kind of your heart goes out to her.
When I first met with Dr. Sudi John Hungary and she looked at my charts, she saw that there was a malfunction in my DNA and told me that they had discovered that I have something called Lynch syndrome.
Lynch syndrome is a hereditary cancer syndrome that increases the risk of colorectal cancers, and that is what placed Gabby at a higher risk for this cancer. What we were able to do is use some exciting new immunotherapy to treat her, and because of the Lynch syndrome, we were actually able to use that.
I did that for 5 months, and by the end of 5 months, the cancer was dead. And they went in and removed the mass and all the scar tissue and the lymph nodes around where the mass was. I am now cancer-free. To ring that bell, it is emotional. You got on the other side of this giant obstacle.
Hi! So good to see you. So good to see you. How have you been?
Gabby is just an amazing human being. She's a fabulous mom, and I think she's touched so many lives. And going forward, her prognosis is great. Hoping that she's going to have a normal lifespan going forward and never have to deal with this cancer again.
I am teaching at a full-time load with dance technique from jazz, hip hop, and tap. I do know that my pregnancy and Ezekiel saved my life. I know for a fact I would not have listened to my body. Ezekiel gave me the gift of life as I was giving him the gift of life. And I believe that's going to make an inseparable bond for us.
Welcome back to Intermountain Health special patient education programming today, talking about colorectal cancer and educating you about lots of options and screening, and talking more about this disease and what you need to know to prevent it, and if recognize some of the signs that you may need to get some medical attention with this. Dr. Crabtree is joining us now. Kathy Crabtree is our Chief Medical Officer here at Lutheran Hospital. Thank you so much for joining us.
Sure, anytime.
We appreciate it. We were talking that this type of cancer is a very common cancer right now. What are some of the symptoms or signs that I need to be aware of?
Yeah, you know, it's really interesting because the symptoms and signs really vary between patients. Sometimes patients can have some abdominal pain, but lots of times it's unexpected things like weight loss that you can't quite explain, fatigue that you can't explain. They might have a change in their bowel habits. A narrowing or a thinning of their bowel movements is one of the potential signs and symptoms. So various things can come up, and you really just need to go to a doctor to get them checked out.
Your primary care physician is the best place to start.
Absolutely.
I would imagine. So we'll talk more about that in a minute. But at what age do I need to really start paying attention and honing in on maybe going in for regular screenings?
So regular screenings now start at the age of 45, with the gold standard being a colonoscopy. But if you have a family history, you might be recommended to actually get checked sooner. So it just really depends on the person.
So let's talk about the gold standard for just a moment.
Yeah.
I think everybody thinks they know what a colonoscopy is, but
Yeah.
just in case, what is a colonoscopy? There's a little prep time. Talk about how it's gotten better.
It has gotten better. So the meds have gotten better to
Yes.
kind of clear the colon, right? And just the screening process in general. So colonoscopy is a scope, for lack of better words, or a camera that helps you visualize the colon. And you have to prep, so you have to make sure that your colon is clean and that we can visualize all areas of the colon as we go in with the camera. And so the prep has gotten better in the sense that the medications around it help clear the colon faster than starting, the typical 24 hours before. But there are diet changes that you make the day before, and then you take your medicines the night before, and you clear your colon for the next morning or afternoon colonoscopy, depending on what time you have it done. But again, gold standard, going in, taking a look camera-wise throughout the entire colon to look for any polyps or masses or changes along the colon lining.
And it's important to note that the actual procedure doesn't take very long at all.
No, generally 20 minutes, if that, to make sure that everything looks clear. Now, generally, if you see something like a polyp or things that need to be removed, things can take a little bit longer.
Absolutely. Again, talk to your physician if you've got any hesitation. There are some at-home testing kits. They won't catch everything, though.
That's true. You can look for DNA testing, stool DNA testing. The problem with those is you have to repeat them every 1 to 3 years. Same thing with the fecal occult blood testing. Again, not typically the gold standard, but can be done if there's any adverse reactions that you might have to anesthesia or something along those lines.
Typically, if they don't find anything in your colonoscopy, how long before you have to repeat it?
10 years, unless you have some sort of risk factor that would impede that, and you'd have to get done sooner.
Now, let's talk about preventing this from happening at all, finding a polyp or developing cancer. What are some of the things that I can do to prevent this from happening?
Well, they're the standard things that every physician will tell you anytime you
Eat
meet
better,
with them.
exercise,
Eat better,
come on.
exercise, stop smoking. A diet high in fiber, protein is typically the diet that's recommended across the board for anything, right? But really minimizing alcohol, some of those things that we consider carcinogens like cigarettes and alcohol, and then getting out there, exercising, maintaining a healthy weight is probably the most important thing you can do for yourself.
And how do you convince your patients to take better care of themselves? I'm probably one of the worst, as you know.
Well, I wouldn't say that, Greg.
No, I am.
You know, honestly, it's starting small, making small changes in our habits and really recognizing where this comes from, where are you strayed off the beaten path, and, just starting small, finding those little habits, whether it's just increasing water and taking it step by step, and then over time, those are cumulative, and you can really make a difference.
And lots of resources out there online to help you do that. Talk to your primary care physician, which we can't encourage enough. And don't ignore the signs, for sure.
That's right.
Dr. Crabtree, always good to see you. Thank you.
You
Dr.
too.
Kathy Crabtree is our Chief Medical Officer at Lutheran Hospital. Go to intermountainhealth.org for more information about setting up an appointment with your primary care or lots more details about cancer prevention.
A 120 years ago, just after the turn of the 20th century, wonders were emerging. Telephones were in wide use, Ford's automobile hit the road, and electricity began lighting up cities. Also at that time, a disease known as tuberculosis was a leading cause of death in the United States. And so, in 1905, Lutheran Medical Center began as the Evangelical Lutheran Sanitarium, a tent colony for tuberculosis patients. Providing the best possible care for those patients marks the beginning of our dedication to compassionate healthcare. And over the decades, we grew as the community and its healthcare needs grew. Babies were born, lives were saved, and people were cared for with ever-evolving methods to help people live the healthiest lives possible.
I see the legacy of Lutheran continuing on no matter where we're at.
I think the things that will stay the same when we move to the new hospital are the great feeling of community and the great care that we deliver to patients.
Being in this new location is going to really help us grow our trauma program.
The caring, the feeling of family, I think that's just built into this.
The opportunity to build from the ground up has provided us with new efficiencies and technologies. These advancements allow us to take our next steps in excellence for patient care. Our continuous improvement teams were highly engaged in the design process, spending months working with frontline caregivers and leaders, mapping out workflows and evaluating caregiver travel distances and availability of supplies and equipment required for patient care. All inpatient rooms were built to ICU minimum specifications, allowing this hospital to meet the patient care needs well into the future. Nurse servers are incorporated into every patient room, which allows for medical supplies to be stocked without having to enter the room and interrupt patient care, and reduce patient exposure to infections. And the consolidation of services, such as pre- and post-operative care, means we can more efficiently care for a large number of patients. For the good of our community, we are boldly and intentionally taking our next steps in excellence for patient care.
Obviously, this current facility has been built on many times over the years, starting from 1932 all the way to 2008. And the technologies were always great when they were built, but technologies have changed. And so it's going to be vastly improved. So it's going to work much more functionally for all of the care teams.
We like having a high-level NICU in close proximity with access to any care that baby might need after delivery. We like to have immediate access to operating rooms in case mom has something critical that happens. Top-level high-tech equipment so that we can take care of baby and mom.
In the new hospital, we have state-of-the-art new MRI scanners, CT scanners, new operating rooms with all of the state-of-the-art equipment, and new interventional cath lab suites.
Having a helicopter pad that's on top of the roof with an elevator that brings patients from the roof down to either the emergency department or immediately into the operating room provides for rapid management of any acute life-threatening injuries.
I think the most exciting thing for me in this new building is the healing environment that it brings to our community and the patients we serve. It's just so bright and refreshing and a new place for our caregivers to provide excellent care to our communities.
I am personally excited about how art will enhance our healing environment. From the ground to the walls, to the ceiling, these pieces foster a peaceful, contemplative, and curative atmosphere for our patients, caregivers, and community.
For patients, we're reducing anxiety. For visitors, we're providing a distraction. And for caregivers, we're creating an environment that is a pleasure to come into.
We are ready, excited, and eager to serve our community for the next century, in a facility built to grow and change with our patients' needs. And we will, all the while remembering who we are at Lutheran Hospital.
There's been so much collaboration and conversation, like how do we maintain what we have here in terms of the culture? And it's an ongoing focus for a lot of our groups. And it's just remarkable to see how important that is to them and how to make that transition so that that piece never leaves Lutheran, because that's really the heart of Lutheran.
To all who have contributed through time, talent, and treasure, thank you.
We haven't ever done a campaign this large, and we feel like embarking upon this has really energized the community towards the goodness that Lutheran is doing.
Just look at this breathtaking structure. It's difficult to imagine that we started out in simple tents more than a century ago. Much has changed since those humble beginnings, yet what truly makes Lutheran Hospital what it is today and tomorrow has never changed. Your commitment and trust in us and our ongoing commitment to this community will ensure that we help more people live their healthiest life. Welcome to the future of healthcare in Jefferson County. The new Intermountain Health Lutheran Hospital. We're here for life.
Again, welcome back to this special patient education series brought to you by Intermountain Health. We're talking about colorectal cancer. That's our focus, and as it is Colorectal Cancer Awareness Month. Dr. Log is joining me now. He is an oncologist with Lutheran Hospital and Intermountain Health. Thanks for joining us.
No, appreciate it.
It's a pleasure. You have lots of experience in treating all sorts of cancers, but specifically tell me about what's unique about colorectal cancer and what I as a potential patient need to know.
Yeah, well, so colon cancer, it's actually very curable. That's actually one of the things that makes it great. The idea is if we catch it early enough, the rates of cure are very, very high compared to other cancers.
Talk about family history and what that plays in a role of my susceptibility to this type of cancer. And there's been some talk about getting DNA testing, or just getting more screenings done more frequently. What should I know about that?
Yeah, well, again, we try to customize that risk profile to certain patients because, again, everybody does have different risks. So if you have a family history, that definitely increases the risk of you getting colon cancer. So let's say that you had a family member get colon cancer at the age of 55. we would recommend getting it 10 years, so 45, and that is generally the recommendation. But let's say that you had a family member get it at 50. You would actually qualify for colon cancer screening at 40, so even younger than the general population.
So knowing that information will empower you as a patient.
Yes. Yep.
Talk to your primary care.
Yes.
Let them know,
Yeah.
make sure they got that in their system and understand.
Exactly.
Let's talk about polyps.
Okay.
You know, the polyps are what, am I correct in this? They're what develop into cancer, which is why we need to find them early.
Correct. And so if we look at the normal trajectory of what we would consider colon cancer, again, it starts off with almost like what we call abnormalities that start to happen, and then those abnormalities ultimately turn into polyps. And then the idea is if we leave those polyps alone for years, that's what eventually turns into colon cancer. And so that's actually the advantage of colonoscopy, is that we can actually, if you can capture these polyps, remove them at an earlier phase, that can actually prevent you from actually developing colon cancer. And so the advantage of colonoscopy isn't just to detect it, but to actually catch the polyps early so you won't ever develop colon cancer.
So when should I talk to my doctor?
So it's never a bad time, because again, everybody has different individual risks, right? So what I always tell patients is, we also want to provide you with information and peace of mind, right? So again, let's say you're 20 and you're like, oh my gosh, my grandfather had, colon cancer at 80, what is my risk? Again, the education that the provider can give you, again, gives you peace of mind. Like, hey, your grandfather had it at 80. It seems like he's doing well. It was this early stage colon cancer. So that person we would say would probably qualify, to have the normal screening at the age of 45, right? But again, it gives them that peace of mind. But now they've had that conversation, so now for the next 20 years, they can at least rest a little bit easier.
Yeah. Are there any specific symptoms that should be a red flag for me?
So yes and no. So again, one thing we always do worry about is bleeding, right? And so bleeding is definitely a big sign and symptom, but the hard part is we have other reasons that you can bleed, right? Again, hemorrhoids are a very common symptom. But what we look at is, again, once you develop the symptom, that means you've also already developed the cancer too. So just to kind of go back, what we look at is, there's different modes of prevention in medicine, actually. So the first mode of prevention is what we call primary prevention. So that means that these are preventions that stop disease from happening, so like vaccines, right? So again, let's give you the COVID vaccine, let's give you a measles vaccine, let's stop you from smoking, so let's stop you from ever getting lung cancer, heart disease, polio, things like that. And then you have secondary prevention. So secondary prevention means that you don't have symptoms, but we're capturing the disease early. So that's where a mammogram comes in, actually. So again, a mammogram doesn't stop somebody from getting breast cancer, but we detect the breast cancer early enough where our interventions are more effective. So colonoscopies, the great thing about colonoscopies is they are secondary prevention, where we can do a colonoscopy, detect the colon cancer early, but the great thing is if we snip the polyp before it becomes cancer, it actually acts as a primary and a secondary prevention.
Interesting.
So the hard part about symptoms, right, is when someone develops symptoms, now you're treating as what we call tertiary prevention. So, think of someone who's had a heart attack and stroke. The difficulty is when you develop the heart attack and stroke, the symptom is the disease, right? But now, again, what we know is that the primary prevention is more effective than secondary prevention is more effective than tertiary prevention, and so the efficacy of the therapies, less effective. And so that's why capturing it as early as possible is a
Bottom
big
line,
key.
you do not want to be late to this party.
Correct, exactly, exactly. Because it's very preventable.
Yeah.
And just to kind of emphasize that, there's multiple ways to screen, actually. So one way to screen, again, there's a stool test that you can do, where they look at the DNA of the colon to see if there's any abnormalities that could be colon cancer, right? Most people think of the colonoscopy, and again, definitely the colonoscopy is still what we would consider the gold standard test, but there are other tests. So again, that Cologuard test, and then we can do what we call fecal cult, where we actually test the blood for stool, but that's a once-a-year test. The Cologuard is every 2-year test. The colonoscopy advantage and disadvantage is it's a 10-year test.
And at the end of the day, what we would hope to do, as I've been talking to others about, is getting upstream of this and preventing it from happening to begin with. And that's really where we have the responsibility as a patient.
And so, again, so eating right is always going to be a good thing. So what we've seen is, high fiber diets, legumes, fruits, vegetables, so avoidance of processed foods, like overcooked foods, that have like a lot of tar and burnt food kind of thing. So there's also some studies that look at aspirin, so low-dose aspirin, 81 milligrams, can also help prevent the development of colon cancers as well.
Interesting. Well, I do love the Thai food.
Yes, exactly. Well, again, all of us do.
And I am from the South.
Yeah.
So say no more.
Yeah, again, you look at my dad bod, you know that I don't avoid those foods either.
Your dad. I'm telling you right now. Last piece of advice you would offer anybody who maybe has a question about this or is concerned that they may have some sort of
but again, always talk to your doctor. I mean, again, they're a great resource, right? Because again, yes, I know there's a lot of other things you're kind of focusing on, like, again, do I get vaccines, hypertension, diabetes, but again, doctors are there to be a resource, and we don't mind that, and we would always rather address things and your concerns way ahead of the time. So whether it's, again, mental health, again, the sooner that's addressed, the better, whether it's cancer. But again, talk to your doctors and know that they're a resource for you.
That's awesome. No matter who your primary
care is. No matter who they are,
yes.
exactly.
I mean, we encourage you to go, wherever health system you use, talk to your doctor.
Yeah.
Dr. Locke, it's always good to see you. Thank you, my friend. I appreciate it.
Thank you. Yeah, thank you.
We have jumped cross lobby now here at Lutheran Hospital. Look at this fine team from our cancer program here at Lutheran. Thank you guys for staffing our informational booth today. We're talking about colorectal cancer. We're talking about ways to prevent it, tips to understand the disease a little bit better, and most importantly, take some of the fear that you may have when you were talking about colorectal cancer. Let me introduce you to my good friend Tammy. Tammy is one of our oncology nurse navigators. Tammy, thanks for joining us. We appreciate
you bet.
it. Tell me what a nurse navigator does in your
So a nurse navigator interfaces with a patient right after they've been diagnosed with cancer, and we partner with them, we help navigate them, we answer questions, we're supportive. We look for barriers that might prevent them from getting care and help remedy those. So we're a point of contact for them, a support person, an advocate.
Yes, you are an advocate too. We appreciate that work. And as part of our education, we have brought this inflatable colon into the lobby of Lutheran Hospital. Not many people have walked through this, but it's obviously not a real colon, but it does illustrate some of what you may find inside the colon. First of all, this is what we really want to find. This is what a healthy colon tissue.
Healthy colon. You want nice pink tissue, healthy colon, yes.
And that's what you find in a colonoscopy?
Yes.
Which is kind of the gold standard for preventative screening.
It is.
If we find a polyp in our screening, which is not all that unusual, you shouldn't be freaked out about that, but it's important to get these removed. Tell me why.
Yes, so 14 to 40% of people have polyps, and when the doctor sees these, they can be removed. Think of a mole on your skin. That's kind of a polyp. It can be removed, and that lessens your chance of cancer.
The next illustrative part of this walking exhibit is the colorectal cancer. This is what the cancer tissue may look like inside. Tell me.
Yes. So, you can see it's starting to invade, and so we want to address it when it's at this stage so that it doesn't metastasize.
And really that's important with colon cancer because this cancer can spread rather rapidly.
Yes,
Tell me about
can.
that and where does it go in your body if it does?
So if it spreads, the most common is liver and lung. But it can go to bone, it can go to brain, and it can go to the lining in the abdomen. So, it can spread.
It is one of the most treatable and curable cancers we've got out there right now. But again, I can't emphasize enough what we've been saying is early detection is key here.
Oh, it is. The survival rate is 90% if it's detected early.
Now, I'm going to skip Crohn's for just a moment and talk about this malignant polyp. This is what a malignant polyp may look like in the stage before it starts to spread. Can still be removed, right?
Absolutely, and it would be removed, and the tissue would be sent to the pathologist and analyzed, and based on those results, how it would be treated.
Now, Crohn's disease, as I just mentioned,
Yes.
step back here and take a look at this. Crohn's disease, not colon cancer. However, it causes you to have a higher risk of colon cancer. Tell me about that.
Absolutely. So the patients that have Crohn's disease are at higher risk for developing colon cancer. So their frequency and cadence of screening with the colonoscopies is going to be more frequent, just to make sure, nothing shows up.
Out of really the thousands of patients you've talked to throughout the years, what is your best advice for someone who perhaps may have a little fear about going to the doctor to talk about some symptoms or getting a colonoscopy?
So people are afraid of colonoscopies because of the prep. Now the prep has been improved, And yes, it's inconvenient, but having colon cancer is more inconvenient. So it's important that you report your symptoms to your physician and you follow up with your colonoscopies at the recommended rate that your physician prescribes.
Thank you. Great advice. It's
Yes.
always good to see you.
It's good to see
Thanks
you
for
too,
all you
Greg.
do for our
Thank you.
patients. And,
Thank you.
And again, if you want more information about all the services that we provide here at Intermountain Health, just go to intermountainhealth.org as we help you get to the bottom of colon cancer.
Yes.
You like that?
I do.
But
That was good.
That was good.